What's going on, guys? It's Jimmy here. So we're here today to talk about a vote potentially going on here in Congress. I'll let you hear it here live for you guys, for yourself, for increasing Social Security benefits. I'll let you hear it directly from Congress, as well as rising costs of prescription drugs, as well as for Medicare costs. I'll let you hear the details here on that as well as an order that President Donald Trump has taken. Details here on that and more in this video. So let's jump right in, and I'm going to give you all the details on this and many changes that are happening here right now that you need to know about. So we are live right now. Let me know if you can see and hear me. Type yes in the chat. Let me know where you're tuning in from. You can let me know your city, state, or even your country, as we have people tuning in here from all around the globe. Don't forget to smash that like button for us. And if you haven't subscribed yet, don't forget to subscribe down below so you don't miss out on future updates. Okay. First of all, we're going to go to Congressman John Larson, who is speaking on the Congress floor about voting to increase Social Security benefits. I'll let you hear directly from him, and then I'll tell you after he talks here about the details, what he wants to increase after you hear him speak, and how they're going to pay for it. So take a listen here to Congressman John Larson.
I rise today to address a critical issue for all of America, Social Security. Mr. Speaker, as you know, there are more than 70 million Social Security recipients in the United States of America. What most Americans don't realize is that it's been more than 50 years since Congress last enhanced Social Security. Richard Nixon was president of the United States the last time Congress voted to enhance benefits. Now, some will say, well, wait a minute, didn't we just recently vote on Social Security in terms of making sure that teachers and firefighters and municipal employees and police officers would be able to get Social Security insurance? And the answer is yes, we did, except it wasn't paid for, which means that when we say it hasn't been enhanced, in fact, what that did is cut the Social Security Trust Fund. So, Mr. Speaker, I rise today to say that it's long overdue that we have a vote on Social Security. That doesn't seem to ask too much of the new Congress, and after all, the incoming president says that he cares about Social Security and has proposed also that there be tax cuts for people on Social Security. That's a good idea, except they have to be paid for, and his legislation doesn't call for that, but ours does. And so we put before the American people and will be bringing to the floor Social Security legislation that enhances the program for the first time in 50 plus years. Imagine that, 70 million recipients. There are 5 million of our fellow Americans who get below poverty level checks from Social Security, having paid in to the system all their lives because Congress hasn't acted. Congress hasn't voted. There are some 35 million Americans whom the only benefit that they have is Social Security. The average Social Security payment, $18,000 for a male, $14,000 for a female. No one's getting wealthy on Social Security, but it is, as I like to say, the lifeline of capitalism, the full support for capitalism. It allows people to take risk, allows us to be entrepreneurial, because in the event the business doesn't succeed or fail, there is that system. The genius of Franklin Delano Roosevelt was that he saw that. And the genius of successive Congresses was that they enhanced the program. But the last time it was enhanced, Richard Nixon was president of the United States in 1971. This also is for Americans a lifeline because of what it does. Speaker Smith was just in the chair before, and I was explaining that in his district, he has over 150,000 recipients, Mr. Speaker. And those recipients are broken down in several different ways, but retirees over 100,000, spouses over 8,000, widows 8,000, 14,000 disabled people in Speaker Smith's district. But they haven't received an increase from the United States Congress since 1971. If you disagree with it, if you disagree that people don't deserve this, to have their Social Security updated, brought into the modern times that we live in, then vote against it. But for God's sake, for the more than 70 million Americans who rely on this and need this, it's long overdue.
Now, Congressman Larson, what he wants to do, and there is a way to pay for this as well, which I'll show you. They want to increase and expand 12 essential benefits for Social Security. Increase benefits 2% across the board for all Social Security benefits for the first time in 52 years. Improve the COLA adjustment, cost of living adjustment, so reflects the inflation actually experienced by seniors, which would be another increase and another boost. Number 3, increases benefits to boost lower income seniors. Increases benefits to boost lower income seniors. So that would be another increase. It doesn't go into the specifications there, at least in this highlights. Improves benefits for widows and widowers from 2-income households. Again, doesn't go into the details here. Restores student benefits up to age 26 for the dependent children of disabled, deceased, or retired workers. Increases access to benefits for children living with grandparents or other relatives. Repeals the WEP windfalls elimination program and government pension offset that currently penalizes many public servants. That, I believe, was actually just passed finally, but this is still listed here. Ends the 5-month waiting period to receive disability benefits. Increases benefits by an additional 5% for most elderly who have been receiving benefits for 15 years or more. Provides caregiver credit to ensure that people, mostly women, are not penalized in retirement for taking time out of the workforce to care for children or other dependents. End the disability benefit cliff, replacing it with a gradual offset for earnings. Cut taxes for middle income beneficiaries. Corrects a unintended flaw in how Social Security benefits are wage indexed to prevent benefits from dropping a notch in the wage index decreases. Ensures that these benefits do not result in reduced supplemental security income, SSI payments, or a loss of eligibility for Medicaid or CHIP. Combines the Old Age and Survivors Insurance, OASI, and Disability Insurance trust funds into one fund to ensure seamless benefit payments. This is the Social Security 2100 Act, pays for these benefits by ensuring millionaires and billionaires pay their fair share by applying FICA earnings above $400,000, with those extra earnings counted towards benefits at a reduced rate. This is how it would actually be paid for, by making them pay back into Social Security on their earnings above $400,000. So they would actually start paying back into Social Security on their earnings above that, but they would get no Social Security benefits for paying into Social Security on those earnings. So they would pay all those taxes there, but actually get nothing for it. Closing the loophole of avoiding FICA taxes and receiving a lower rate on investment income by adding an additional 12.4% tax, known as the NIT tax, only for taxpayers making over $400,000. Now, an additional 12% tax is a lot of money, especially when you already consider that the highest tax bracket is 37% just for federal. You add another 12% on top of that, so you're already at 49%. Then you have state taxes, Social Security taxes, FICA taxes, property taxes, sales taxes, and you're paying the government more than 50% of your taxes. So the government would actually be making more money than you would be. Even though the government doesn't actually work for your money, you would be paying the government more money than you are. You would be paying over 60% taxes. Remember, this is just the federal income tax at the highest tax bracket. So you would be paying, I don't know, over 60% taxes. Remember that just in California has, in California, for California highest tax bracket, they have a 12% tax in the state of California for state taxes alone there. So, yeah, taxes can get crazy. And remember, we fought the British over a 2 cent tax with taxation without representation. We had a revolution over 2 cent taxes. So you guys can let me know your thoughts there in the comments. Also, I've been getting a lot of questions. If you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter Medicare. I've been looking for a place that would help all you out, and Chapter has knocked it out of the park. They've got excellent customer service. In January through the end of March is the new open enrollment period for 2025. They can look at every single plan that's available in your area through all the different carriers, and their help is always 100% free. Give them a call with the phone number on the screen, or you can click the link down below in the pinned comment or the description of this video, and they will be able to get you the best plan and coverage that you need, as most seniors are actually on not the best coverage. Also, over 1 million people are going to be losing access to their doctor in 2025 with the new changes that are happening. So call the phone number or click the link on the screen right now and tell them I said hi. Yeah, so President Trump has actually revoked President Biden's order to lower prescription drug prices for Medicare. Biden's executive order to lower copays for some drugs to as low as $2 for Medicare and Medicaid enrollees has been nixed by President Trump. President Trump has been busy rescinding the Biden-era executive orders in his first day in office, including one that had potential to lower the cost of prescription drugs for many Americans on Medicare. Known as Executive Order 14087, it was designed to identify a list of prescription drugs that would, under the plan, require only a $2 copay per month for anyone on Medicare. Former President Biden had directed the Center for Medicare and Medicaid, an arm of the Centers for Medicare and Medicaid, to look into ways to make prescription drugs cheaper for Medicare. Quote, Biden said, too many Americans face the challenge of paying for prescription drugs, and Americans pay 2 to 3 times as much as people in other countries. And 1 in 4 Americans take prescription drugs struggle to pay for their medications. Nearly 3 in 4 American adults who take prescription drugs say they have skipped doses, cut pills in half, or not filled prescriptions due to their cost. Let me know if you can relate. Well, As Trump has now rescinded this executive order, Trump said, quote, "The previous administration has embedded deeply unpopular, inflationary, illegal, and radical practices within every agency and office of the federal government." He warned, "The revocations within this order will be first of many steps from the United States federal government will take to repair our institutions and our economy. Other Medicare and Medicaid existing laws and regulations around prescription drugs remain in effect for now. It is unclear what Trump will do about Medicare's ability to negotiate lower prescription drugs as well under the IRA, the Inflation Reduction Act, put on the book in 2022. President Trump hasn't said if he supports the government's ability to negotiate with the drug companies directly. So I will keep you up to date here as things are changing here literally by the day. So you guys can let me know your thoughts on this. There's a lot of changes happening here. So make sure to subscribe down below so you don't miss out on future videos. And make sure to check out Chapter Medicare down below with the pinned comment down below in this video. Click here to see emergency price relief by Trump, or click here to see Trump activating the military. Thanks for watching, and I'll see you in the next video.